This is Mark Newman, the founder and president of Precision Analytical, the makers of the Dutch test. And today I have a very exciting announcement for you. We have been working diligently over these last really months and years on putting together a collection of information for you to use as a resource as you start to enter into the treatment phase of your relationship with your patients, uh, particularly those for whom you've use the Dutch test where you've got the results. And then the next question is generally, okay, what now in terms of treatment? And we've put together this treatment guide, which will be available to you shortly and sent out to our clients in the mail, and will also be available electronically. And we would encourage you to use it as a resource. By way of disclaimer, which you'll also find in the treatment guide, of course, this does not reduce your need to take into consideration all of the things that you're always having to think about as a doctor, and for you to make those decisions about what actually makes sense given the totality of a particular case. We always want to remember that the Dutch test, comprehensive as it is for reproductive and adrenal hormones, we always want to consider these other areas of health that are important: the thyroid, the pancreas, your gut. If there's exposure or some infection, like those things always have to be dealt with in every situation. And this treatment guide is going to really help you as you dig in specifically to the things related to reproductive and adrenal health for your patients. Let me walk you briefly through how this treatment guide is intended to be used in your practice. For cortisol, for the female reproductive hormones, for the androgens, for each of those sections, we're going to walk you through these 6 very relevant questions. We're going to start by asking questions about symptoms. What symptoms is your patient experiencing that might be related to the particular hormone that we're looking at? And then we want to quickly pivot to what else might cause these symptoms. So as we look at cortisol as an example, we can look at the symptoms of having not enough cortisol: fatigue, low libido, sleep apnea, or symptoms of high cortisol like anxiety, insomnia, weight gain. Once we've identified the symptoms that may be related to these hormones, we want to look closely at other causes potentially of these symptoms. So if you know the patient has a significant electrolyte imbalance, just as an example, then before we consider cortisol and its role in fatigue, we might want to know what other things might be driving some of these symptoms. So if we have symptoms of high cortisol like anxiety or depression, knowing that high estrogen and low progesterone, so estrogen dominance, might play a role in a mood disorder as well, we want to consider those things before we're diving in on the cortisol side. So we're looking at the symptoms, what else might cause those symptoms, and then we want to look at the patient's lab assessment. Are the patient's lab results actually low or are they elevated? So we're breaking down cortisol as an example into these 4 categories: low and high and normal, and then what we might call adaptive. So we're going to define those for you, and then we can look at those closely as it relates to the actual results that you have for your patient to try to define them a little bit better before we move on to treatment. So as an example, this patient who has either a urine result from the Dutch Complete or the salivary results from the Dutch Plus, we're looking at those patterns. We're looking at our guide here that says if we've got a bunch of low results, and if we also add in the metabolites of cortisol, and that's also low, we might categorize this patient as having low cortisol, which may correspond to the symptoms that the patient is having as well. So we want to look at their symptoms. We want to look at the lab results to see if there's some continuity there. And then we want to look at, before we consider treatment, what are the root causes that might influence your patient's abnormal lab levels? So as it relates to the adrenal hormones, we've got a section on low cortisol, high cortisol, low DHEA, high DHEA. So just as an example, if the patient has low cortisol, we want to look at these things that might be influencing it. So if your patient, as an example, tells you that they're an MMA fighter and that they've taken, repeated blows to the head and they've got head trauma, we need to know and take into consideration the fact that this can be uh, very much related to someone who has low cortisol whose HPA axis is not functioning properly. So they might be taking medications or have other situations that might drive that hormone imbalance that you might want to deal with and consider before you move on to treatment. So what treatments, and this is kind of the central core part of why we generated this, is to create this nice list of treatments that might be considered for different situations. So what treatments may be considered for your patient's hormonal dysfunction? So this part of the treatment guide is going to really help walk you through that. So we're look at the top here for cortisol. If someone's low, if or what we're calling adaptive or high cortisol, we want to categorize them that way. And then we're also further categorizing them with their night cortisol. So is your cortisol around bedtime elevated or not? So in this particular case, the overall cortisol is low, but at nighttime, the cortisol is flaring up, right? And we've also included for this particular patient, and this is our new report format, which will be available within the next few months. But the insomnia sample is currently available in the Dutch Plus, so we can look at cortisol not only at bedtime, which in this particular case is elevated, but also in the middle of the night, which is our insomnia sample. So those are elevated. So overall, this person has low cortisol output, but it happens to be flaring up at nighttime. So that's a pretty specific case. Then we'll look a little bit further at DHEA. So is the DHEA on the lower side or on the higher side? And when we look at this particular patient's results, total DHEA production is low, and we can see that the DHEA markers are all a little bit below range here. So we're going to categorize them as having lower DHEA. So once we do that, now we know that this is the section of the treatment guide that might be applicable for this particular patient. So we're going to look at potential sleep support, DHEA, glandular support. And you can see here this says adaptogenic support. And then below on the treatment guide, we're going to have some more information on that. So that's going to build out different types of products, herbal products in this particular case, that might be relevant for a patient with this particular set of results. You can also see here, because of the high PM cortisol, we want to worry about light exposure in the morning, maybe taking phosphatidylserine at bedtime, because that might help to dampen that cortisol response that's coming in the middle of the night. We might want to consider cortisol supplementation. We know that inflammation tends to flare up cortisol, particularly at night. So these are all the things that you as a provider might want to consider for this particular patient when you're looking at treatment. Once we've established which types of treatment might be considered for your patient, we want to support you in an additional way by looking at specific products that might be considered based on the answers that we found in the first 5 questions. And what we've done is partnered with different supplement companies to provide the products that might match up with some of those recommendations. So let me give you just 2 examples. So we've got a Metagenics and an Orthomolecular. Those are 2 reputable supplement companies that we've partnered with, and we're thankful for their partnership in this, in providing you with the types of products that might be relevant in these particular cases. So you can see on this treatment guide for Metagenics, the cortisol treatment guide on the top. On the lower left, you can see the male androgen treatment guide, and on the lower right, the female androgen. And then on the reverse side, you would see the estrogen and progesterone support material. So as we look back at the cortisol treatment guide, we can see these letters A and B here in the upper left, and they continue throughout. As we look back at this treatment guide, we can see how those correspond to the product specific treatment guide. So as we look at the particular case that we just presented, we can see these 3 products that might be worth considering. Now, this is not a specific endorsement from Precision Analytical of any particular product, but these are the products that this particular supplement company has identified as matching up well with a particular situation, this one being someone with overall low cortisol that might have elevated cortisol at bedtime, which is why we have the addition of the phosphatidylserine here on the lower left. So If you are a provider who happens to prefer Metagenics products, this treatment guide can help you move from symptom to potential treatment and then to potential product that might be worth considering. A second company that we've worked with is Orthomolecular, and we can see the same sort of layout for them here. And then as we look at the same situation for this particular scenario that we've looked at, we can see that these three products might be applicable to people with low cortisol, and then again, potentially in this case, adding in some phosphatidylserine because of that high cortisol at bedtime, and keeping in mind this was low cortisol and low DHEA, but we have all of these other scenarios that you can consider. So for each of the treatment guides, we want to work through what symptoms the patient has, what else might cause them, the patient's lab levels, what the root causes of those abnormalities might be, and then we want to consider carefully treatment options and potentially specific product options. Now that we've gone through in great detail the cortisol section of this treatment guide, I'm going to go through just briefly the other sections of the treatment guide. So for women, for progesterone and estrogen, we want to look again at what are the symptoms that are related, and then briefly look at, as you can see on the right here, what other causes might we consider for the symptoms that are presenting with this particular patient. Then we're looking at a lab assessment. How do we actually evaluate with the Dutch test someone's estrogen status, their progesterone status, and also considering estrogen metabolites. Then we move on to, let's say the patient has low estrogen and progesterone levels. We want to look at some of these considerations to make sure that we're considering those before we move on to any treatment options. And then the treatment page. Right? So for premenopausal women, we're breaking their estrogen into 4 different categories depending on whether it's modestly low, very low, within range, or elevated. We're looking at patients with and without symptoms. And then we're looking at breaking progesterone into these 3 groups that you can see on the left side. Once you identify where your patient is, then we're going to look at some of the considerations, and those may be helpful in treating this patient as it relates to the female reproductive hormones. As you move down further, there are some additional considerations if the phase 1 metabolism of estrogen, so we're looking at that 2 and 4 and 16 hydroxylation, if that's not looking favorable, here are some additional things to consider. And then we move on when we're looking through the Dutch report and look at methylation. We can also see some considerations if methylation is not looking appropriate for this particular patient. There's a separate treatment guide for postmenopausal women where we're breaking the estrogens into slightly different groups and breaking the progesterone into slightly different groups, and then again looking at some of those considerations. Now, when we look at postmenopausal women, obviously that will lead us in some situations into a discussion about hormone replacement therapy. So we've also included a guide for using Dutch testing when you're looking at hormone replacement therapy. There's a guide both for women and for men. So as we look at the guide for women, there's going to be a discussion of each of these situations for which the Dutch test works well. So oral progesterone, estrogen patches, creams and gels, hormone pellets, and then vaginal hormones. Below, you can see some common dosing strategies that you might want to consider as you move into potential conversations about hormone replacement therapy. And then at the bottom, there's some discussion about how to use the Dutch test as you're monitoring some of these therapies. Of course, we also want to consider testosterone. That's broken into gender-specific pages. So for the women, again, what are the symptoms of not having enough testosterone? What are the symptoms of high testosterone? And then again, we're moving into what are the things might cause those symptoms. We'll of course look at root cause analysis, and then into, again, our page where we can look at treatment consideration. So we're looking at low testosterone, normal testosterone, and high testosterone situations with and without symptoms. And then you can see here in the second row, this is one of the things you can see on a Dutch test that you don't get to look at in a blood or a saliva test, which is, do you have that androgenic 5-alpha reductase, that 5-alpha metabolism? And if so, in each of these situations, there might be some different things that you might want to consider. Also, if your DHEA is on the lower side or the higher side, for women, testosterone comes in part from your DHEA. So we want to consider that as an additional variable and consider the treatment options that might be discussed there as well. For men with testosterone, of course, the symptoms are going to look a little bit different than what we have for the women. So you can see here symptoms of low testosterone, symptoms of high testosterone, and then other things that you might consider. And then again, a page for lab assessment of what does it look like to have low testosterone, normal testosterone, and high testosterone based on the Dutch test. And you might, in some cases, as with testosterone, might be complementing this with a serum result, and you might be taking that into consideration as well. And once we've established, let's say a patient has low testosterone, we might want to consider some of these things like steroid use or a zinc deficiency before we move on to potential treatments of either the low or high testosterone when appropriate. So again, we're breaking the male patients into low, normal, and high, with and without symptoms, and then similar considerations that we saw on the female testosterone assessment, and then a separate HRT guide for men to look at these common situations for boosting a man's androgen levels. Lastly, we also have included our overall guide for HRT. So if you're looking at complementing the Dutch test with serum testing, we want to know for different HRT situations where the Dutch test excels, where serum testing excels, so that we're making proper decisions in terms of evaluating doses and monitoring, of course, the metabolism of those hormones. So I hope this has been helpful. We are excited to get this treatment guide into your hands, and I think you'll find it a valuable resource as you search for answers for the patients that you are assisting. And we want to assist you in that process. So do keep in mind, for providers, we have free consults available to help you work through the interpretation of your results. And we hope that this treatment guide will also be an important resource for you going forward.